Good afternoon, everyone, and welcome to your Friday afternoon habit. We have hashtag Chakra Chat. I am Teacher Sam, and joining us in a few while is our guest for this morning. So, this week's Chakra Chat is brought to you by our friends from Strong Radio. Strong Radio is our official media outfit for the rest of the week, and I think they've been sponsoring and helping us for the past few weeks already. So thank you again, Strong Radio, for making our live discussions and our virtual classes available for a lot of our subscribers and to all yogis and yoginis around our country. By the way, for the information of everyone, I am from XUGS, and for our XUGS parents and stakeholders out there, I will be guesting in Strong Radio tomorrow to talk about XUGS flexible learning arrangement, which we have for the upcoming school year. We already had our information session earlier and yesterday. And for those who have missed those sessions, it's still available in our grade school XUGS official Facebook page. But if you still have more questions, I'll be available tomorrow at Strong Radio. Again, Strong Radio is also the official media partner of Chakra Yoga Studio. And you can be like Strong Radio and the others who have made our programs in Chakra Yoga Studio possible. We have been sponsored by a lot of our local entrepreneurs. We have Makiaki Catering Services, we have BPO, we have Health Talk Nutrition Center of Herbalife. And if you want to be sponsor of our yoga studio through our virtual classes, you are welcome to do so. And we invite our entrepreneurs out there, especially our local businesses, to help us in our cause by sponsoring our virtual yoga classes. And I believe that your resources will surely help us in our cause of bringing mindfulness to each person, one breath, one movement at a time. We are grateful because, in fact, we are already being asked to endorse certain products, such as the ones that I've used earlier in my chair yoga. We have Back Joy, no? So we thank our friends from Back Joy for allowing us to endorse your products and to help us, no? Especially our fellow Cagayanons and other friends subscribing and watching us, through our virtual yoga studio. We thank you for helping us, in our cause. I am not sure if you would agree with me, but for those who were able to view our live streamed video series, we had a very fruitful and rich discussion so far. No, the first time we had our chakra chat live, we talked about mindsetting and positivity. But for the information of everyone, even before we started our live videos, we already had chakra chat sessions with teachers. No, in fact, those chakra chat sessions are some of them are also live stream. No, Teacher Echo, Teacher XT, June and I also had their chakra chat sessions as well. So there are a lot already, but the formal ones, the one that we use using our official platform, no? If you look at the right top of your screen, there is a logo there. No, the first time we started using StreamYard is when we talked about mind setting and positivity. I'm not so sure if you remember it, but it was a very nice discussion as well. We also had a very fruitful and rich discussion when we asked you, when you were able to ask anything about yoga, right? If you remember it, and those burning questions you had were responded to by our yoga teachers at Chakra Yoga Studio. And we feel that considering the amount of questions, and especially those that we weren't able to answer, we are planning to have another session similar to that, no? In our succeeding sessions, puhon, no? Because we recognize that there are a lot of you who are requesting for more opportunities for you to ask questions, no? So that's a good session as well. And of course, if you remember, last week was more of a specialized session for parents and teachers. We talk about kids yoga, and I think that that was a refreshing take on yoga as well, since I have a lot of friends, no, who seem to be quite intimidated about yoga because they thought that they need to be more flexible and all that, no. But you see that when Teacher Honey shared kids yoga, we see and understand and appreciated more the inclusive nature of yoga, because essentially everyone can do yoga, you know? And we realize that yoga is indeed universal in a sense, since everyone can actually have fun and practice with it. And for the information of everyone, I like our discussion for today because uh, um, it during the time that we had our second chakra chat session through StreamYard, there were a lot of questions about, can I practice if I'm high blood? Can I practice if I have this and this predicament that I have? No? So I think that this is a perfect opportunity for you to really ask those questions now. No? Um, our guest for today is a medical and a yoga practitioner. No, she has been attending yoga classes, and she's a doctor, so it's a perfect mix. And what a great way, no, to have free consultations. As one of the yoga teachers, teacher Mitch, I think, is watching right now with us. And as Chakra Yoga would wish our subscribers to continue and help yogis and yoginis out there to deepen their practice or at least try yoga, today's episode will focus on on some of the medical aspects of yoga, with of course our guest for today. We're just waiting for our guest doctor for her to tune in and sign in, but I'm sure that she'll be around pretty much soon enough. So just relax and enjoy the show. You can have your drink here. Like me, I have here my infused water with lemon. So just enjoy the show and sit back and relax. And I hope, hopefully, we can have a great discussion as usual here in Chakra Chat. So, if you're just curious about what yoga is, or if you just wanted to continue nurturing your yoga practice, I think that our Chakra Chat sessions would be perfect for you. And if I'm not mistaken, for next week we also have another guest from Gallup. He is a certified coach, and I think the direction of our next week's topic will be on financial wellness. No, so you see that our chakra chat sessions here are not just focused on yoga or the practice of yoga in itself, because in chakra yoga studio we believe that how we live our lives is really connected to how we do our yoga practice as well. So like now we focus on health. Next week we focus on financial wellness, and we are trying to explore other topics as well related to how can we have a holistic way of living our lives. No, I think that's the main purpose of our yoga practice in essence. Okay, so yeah, let me just wait for our guest um, for today, and I'm sure that she'll be around soon. But I encourage everyone to really ask questions. No, it's your perfect opportunity to to really ask, the questions that you have about your health, and how can yoga assist you in responding to the needs of your body, no? Because basically yoga is about responding to your body's needs, and it's a very important skill, no? And second nature to all yoga practitioners to listen to how their body, what is the state of their body, and how to respond to the needs of their body. Okay. So let me just introduce our speaker first while waiting for her so that we be able to save more time and maximize our time for our Chika session. Okay. I have the honor to introduce our guest for today. She is a graduate of medicine at the Dr. Jose P. Rizal College of Medicine, Xavier University, batch 2004. And our speaker for today had her internship at the University of the Philippines, Philippine General Hospital, or more commonly known as PGH. She had her adult neurology fellowship training at the Department of Neurosciences, section of adult neurology at UP PGH from 2007 to 2010. She is a fellow of Philippine Neurological Association since 2011. She had her stroke research fellowship at the National Neuroscience Institute Singapore General Hospital campus from 2013 to 2014. She is a neurologist for Akbay Stroke and Neurological Rehabilitation Center, Polymedic Plaza, since 2011. She is a part-time associate professor of Dr. Jose Rizal College of Medicine, Xavier University since 2011. And she is an active consultant in the Department of Internal Medicine of Maria Reina, XU Hospital, and medical officer in the Department of Internal Medicine. So our speaker for today will be joining us in a few while. I think she just have some technical difficulties as of the moment. Hopefully, she'll be able to resolve her technical difficulties and join us in our Chakra Chat session at this point. Sige. So again, I encourage everyone to really try their best to ask questions so that later when our guest would arrive, we'd be able to respond to these questions as well. Okay. Sige. I think she's trying to just trying her best to join us because as of the moment, I think in their area and which a lot of areas right now, there seems to be problem in our energy. No, the electricity seems to be so unstable in some areas, and unfortunately, it's at this point in their area. No, they have been difficulty. They are experiencing difficulty um, with their electricity. No kuryente daw, according to her. But anyway, we hope that she'll be able to log in a while. We think our viewers right now, there are, I think, 10 of you who are viewing this Chakra Chat. And as of the moment, we're just waiting for our guest doctor. The interesting part here that our guest for today is both a practitioner of yoga, meaning she practices regularly doing yoga, and at the same time, she's a medical practitioner. So she really understands, no, anything related to health and wellness in our body at the same time. Okay, so based from the comments, I think they're setting up. So don't you worry, our teacher will be here in a few while. So thank you very much to our teacher. See, Teacher Mitch was the one who really encouraged her not to be part of this conversation. And Teacher Mitch will actually will be also one of our guests in one of our sessions pretty much soon. And I think it's very interesting to listen to teacher Mitch's story on how she became a yoga teacher and how she grew in her practice of being a yoga instructor. So, oh yes, so our teacher comes from Apobel, and as of the moment, we have difficulties in terms of our electricity, no, walay kuryente, no, but sige lang. I think the important thing here is that we be able to interact with each other. So it's very important to write your questions in the comment section below so that we'd be able to clarify some of these questions through our guest this afternoon. So we're just waiting for our guest to sign in. Don't you worry. Most, if not all, of your questions will really be answered in as much as we could. Okay. So we have here. So we don't have questions yet. It's more of like they're setting up now, and then some are encouraging also others. Like we have teacher XT here. So teacher XT says, feel free to ask questions. And let me just acknowledge uh, the picture of teacher XT here, no, in his profile. Very nice and very bold, no. We are also celebrating Pride Month, no, because one of the core values of Chakra is inclusivity. So we also recognize our friends from the LGBTQ plus community. Okay, so let's. By the way, we have a lot of. One of the things that I think this pandemic has allowed us is to bring in a lot of teachers, yoga teachers coming from different parts of the Philippines and even different parts of the world. We already have teachers coming from Saudi Arabia and even local teachers in Marikina and in Manila who are joining us and teaching us yoga. So we thank Chakra Yoga Studio for really bringing in a lot of this experienced teachers, and we are very happy to have them in Chakra Yoga Studio. So last, I think Tuesday, we had Iron Yoga. Okay, I think teacher Odette Mills will still be having her Iron Yoga pretty much soon enough. So please join a high intensity type of yoga. Now, if you're really, no, because there are some people who really are not so familiar with yoga, and they said that I don't seem to be comfortable with doing yoga because gusto ko pinapawisan ako, no? So, but if you try her her class, you really would expect to perspire a lot and sweat a lot, no? And later this afternoon, we still have our class, our Yin Yoga class with Yin Yoga class with teacher Nats at 4:30. Okay, so yeah, so at 4:30 we have Yin Yoga class. The Iron Yoga was last Wednesday, yeah. And I think that teacher Odette will be joining us again in the next few weeks, no? Because our June calendar is really so vivo, no? Um, and tomorrow we have Ashtanga Yoga with teacher XT at 9 o'clock. And then we have sound healing with teacher Echo. And then, of course, on Sunday, either tomorrow or on Sunday, we'll be giving you more updates on our schedule for the next week. And would you believe that it's already June? No? Uh, yeah, so we have here from teacher XT on June 17, we will be having our Iron Yoga. So I think hopefully when my schedule permits, I'd be able to join that as well to have a different kind, high intensity type of yoga. So that's on June 17 for our Iron Yoga. Okay, I hope that Dr. Natasha, I think Dr. Tash at ang iyahang dagnay, no, would be able to um, log in pretty much soon enough. Yeah, Teacher XE is saying that we will be having more guest teachers. And Teacher Mitch and Teacher Eddie are trying all their best to help our guest teacher to log in. And aside from guest teachers, like what we're having now, Miss Natasha is actually a yoga practitioner, meaning she's a student, not necessarily a teacher. So we also are encouraged to invite, no, and share experiences coming from our students as well. So you wouldn't know. Maybe one of you will be our guest here in our Chakra Chat session soon. No? So let's see. So Teacher Mitch is saying that they shared the link already to our Doctor Yogini will be joining us. I hope that she be able to join us soon. Yeah, I think that that's really one of the limitations right now. She really has a slow internet connection around their area, primarily because as well of um, um, the electricity, no, concerns in that area. And coming classes, we have rocket yoga, vinyasa class, gentle flow. There's also a nirvana yoga. There's an inside flow and many, many more. In fact, this week we already have added several classes. Teacher XD has been doing mindfulness and meditation yoga uh, every Tuesday after my classes, after my Rekindle Hatha yoga classes. And I also have a back joy chair yoga, which we had earlier. No? So, yeah. So I hope that you'd be able to drop in your questions while waiting for our Dr. Yogini to be in. Okay. So again, we thank our friends from Strong Radio for allowing us to show our virtual classes um, to our subscribers and to all our yogis and yoginis who are following us. And we encourage other participants to really help us, local, to help us, other local entrepreneurs to join us. I think she's here. Let us all formally welcome our Dr. Yogini, Dr. Natasha Wabe. Hi, Doc.
Hi, good afternoon. Sorry, I had
How
problems
are
with logging
you?
in. I'm okay.
That's
Nagdali-dali.
good to hear. Finally,
Ah,
you're
sorry.
logged in. Brown out sa inyo
Yeah.
ha, Doc?
Timing kayo of all days. Karon gyud siya nag-brown out. So nag ano siya, medyo low tech akong phone so di ko pa kasulod. Babe, live na tado.
Okay ra, okay ra.
Ako gasuban. Sorry. Sige,
Welcome,
sige.
sir. Okay ra, Doc.
Okay.
So, Doc,
Sige.
you've been a frontliner, no? In a sense, because you've been working so hard in the past few days. How are you so far?
I'm okay. I just got off from 3-day duty in the COVID ward. Depende raman pod if na ay extreme calls, then that's the time we have to go into the ward. But we
Mm.
had to stay in the hospital for 3 days. So that's our rotation, 3 days in a month.
Is there a reason
Yeah.
why it's 3 days, Doc? Is that appeal ng quarantine, ana? Ano sa ikuan, ana?
3 days nga in hospital duty and then quarantine for 4 days. Murag i-divide siguro nila kung pila ni ka-consultants. Mo na nga na 3 days nila. And gi-pattern po nila sa St. Luke's, I think. Inana po nilang style daw dito sa ano
Mm.
duty team. Mm. Sige. Ikaw day si
Okay,
Teacher
Doc.
Sam. Okay.
Sige, Doc, since you've been doing yoga, we're interested. What led you into practicing yoga?
I tried it before na interested lang sa F&F, if familiar mo sa FF nga gym sa Manila dati. No, they had different programs in their gym. So there's one program called yoga. We just tried it. However, it was not a very good experience because I felt very insecure kay kada kada week lugar nga moingon ang teacher nga kinsay newcomer or beginner. So mag-raise kog kamot. The following week kinsay newcomer magsige lang kog raise og kamot kay I recently realized bang ang siguro ang way of kanang introduction nga dili man gud siya straight program nga ipa-enroll gyud ka nga committed.
Mhm.
Walk-in ra man gud siya. So dili bitaw gyud matutukan kada student. So that was just that sparked an interest, especially that I'm not really flexible. I'm not at all flexible. Then afterwards, I came across it after I gave birth. I had to lose weight a lot from 80 kilos. So I jogged and then I outgrew the cardio and the jogging. It was so much weight bearing sa knees. So I wanted more exercise, more stretch, and more flexibility. So my sister is very into it. So nag-awat-awat lang. Mura na ang beginning. uh,
Okay. And then, for how long have you been doing yoga, Doc?
mga ano man siguro 2 years, 2 to 3 years man siguro, but that's really on and off. Lately na lang ko medyo na regular, around once or twice a week is a very good number for me already.
Mm,
Unlike my sister nga halos everyday kung pwede, murag dili pwede sa ako mag-fatigue ko.
lagi. Doc, how do
Yeah.
you integrate your schedule in doing yoga? And I know that especially nowadays you've been so busy with a lot of your rounds no in hospitals. Ginaunsa nimong integrate ang imong schedule sa imong pag-yoga o imong pagtrabaho?
Some of us, I understand, want it done in the morning, some sa udto, and then other people at night. With my schedule, I usually do it at in the afternoon when I arrive from work. And then I'm not usually a morning person, so dili good option ang morning. Low bat di good mo andar. Also, if on weekends, mga lunchtime is a good time for me. So also, it has also something to do with fitting it in menstruation timing.
Mm,
If I usually have my period, I don't do it. My sister does it with or without the period. I now understand that some people really need it during menstruation. No? Pero sa ako,
yeah.
it doesn't apply. No? I need the
Yeah.
high progesterone level to do it.
Mm. I
Yeah.
agree because my wife, when it's her moon cycle, she'd still do yoga, but she wouldn't do certain poses as she usually tells the yoga teacher kung unsa iyang gakabatian during that time.
Okay, yes, I agree. Yeah, that's what I learned about yoga. You have to listen to your
Yeah.
body, and it doesn't fit in like a glove. No, one it's different from one person to the other.
So, Doc, what's your advice? I think since we're already in that moon cycle concern already, there are a lot of women doing yoga. What's your advice in terms of should they or should they not? Because I also have been reading a lot of articles of when they have cycle, they shouldn't do yoga. And then other articles would say they still continue do yoga because diba others doc parang easier daw ang blood flow if they do yoga. What's your advice on this, Doc?
Yeah, I think in the end you really have with those conflicting articles, no, or studies, no. In the end, you really have to listen to your body. As I said, no, with my in the case of your wife, no, she can do it. However, except for certain positions, no? So the blood flow will really increase if we have menstruation, because a lot of it is needed, no, over that area, the pelvic area, no. So if she has dysmenorrhea or painful menstruations though, then I think yoga can help, especially in relaxing all the tensed muscle, because in menstruation, although the crampiness or the painful area is inside our belly, actually it radiates all over in the low back, in the pelvis, in
Mm.
the thighs, no. So it might help women with menstruation problems, no, painful menstruation or dysmenorrhea, to do certain poses lang siguro, but not really the overweight bearing type of positions. Maybe because we also have the lowest progestin level. It's like our happy hormone, and it's
Mhm.
very low. It's the lowest in that particular time before the period and during the period. So maybe as unless the person is really very well motivated, her stamina is not that great when she has
Mm.
menstruation. That is why we have problems trying to deal with or regulating our emotions during
So,
menstruation.
sa putong,
Yeah. Yes, tanan, naatanan. Yeah, I'm sure you
sige, Doc.
understand. Mm.
There are some for the benefit of our viewers, Doc. In the introduction earlier, we said that you are a neurologist. For the benefit of those who do not know, what does a neurologist do?
Neurologists handle diseases of the brain, the spinal cord, no, and the nerves. No, so with that, it includes diseases that can be organically traced in the brain, such as stroke, okay, brain tumors, infections of the cerebrospinal system, nerve impingements, tumors of the spine, nerve problems, sometimes autonomic nervous system problems. No, it can happen, and then seizures or epilepsy, if you're familiar with it. So I think that covers all demyelinating or mga neurocognitive disorders, degenerative disorders such as Alzheimer's disease, dementia, and the likes, tetanus, anything that affects the brain and the spinal cord and the nerves. Yeah.
I'm interested, Doc. What led you to neurology? There are different specializations, and why did you pick neurology for you?
Well, it's not a very common subspecialty. There are only around, by the time I graduated, we were only around 200 plus. Now we are about 300 plus. So it's not a common specialty. In our batch of 60, I'm the only one who went into it, and there's another one who went into neurosurgery. And then we had a very good teacher, Dr. Art Sordilia, who inspired us, who inspired me at least to become a neurologist way back in med school in Xavier University.
Mm.
So that's it.
Okay.
Yeah.
Sige. How does, di ba, Doc, there are some researches that say that yoga helps in our brain functioning and even in our nerves. Yet there are few quite concrete evidences that points out to a direct relationship with yoga. Do you think yoga really helps in brain functioning, spine, and even in our nerves? Since you've been
Okay.
practicing doing yoga yourself and you're a medical practitioner as well.
Yeah. So a quick answer would be, of course, yes. Otherwise, I won't advocate it for myself nor to my patients. So, a little bit of evidence. There has been a surge of researches about yoga since the year 2000. It's about 500 of them already. Some are well designed and some are not well designed. Of course, there are a little bit of variations per researchers or researches, and then they have different goals. But one in particular of interest in the field of neurology is the how yoga improves brain function, and in terms of the anatomy and the functionality, no, of the brain, no. So there are a lot of them already. So there was one researcher who had to go through the the process of streamlining all of those researches. So he typed into 6 different databases, the Cochrane, the PubMed, all of those research gates. He typed in the word Hatha Yoga, brain function, brain anatomy, etc. And he came up with this inclusion criteria of including only the published researches or published studies. That's his criteria. The second is the cross-sectional or longitudinal or interventional study, meaning if you give this particular treatment, in this case yoga, you will observe how many of those who did this and how many of those who did not, had a good brain function after. So that's the style of the study. So all in all, he streamed around 11 studies, out of the many studies. And then he had two particular outcomes that he was looking for. It was either the anatomy of the brain changed after the yoga or the function changed. So in the first category, the anatomy of the brain changes, no? They used MRI, functional MRI, PET scan, katong medyo mga high-tech na, no? So they used it to really measure from baseline and after the yoga treatment, no, the anatomy of the brain, more specifically the thickness, of the gray or the white matter. And then, however, in there, because these are 11 different studies, so he just applied the meta-analysis. So because these are different studies, no, there are also variations in how long they perform the yoga treatment. No, we will call it as the treatment. No, they were very varied. Some of them used only like 1 hour per session, and then once or twice a week, and then the minimum of which it lasted was 8 weeks, and then the maximum number of months is around 6 months or 24 weeks. So it was really varied. However, the commonality of them all is that there are areas really of the brain, in yogis, no, sorry to call them yogis, no, to call us yogis, that were thicker than those that are non-practitioners. Okay, those, yeah, they became thicker, no. In particular, no, I brought brain sample with me, but it's not very nice because we cannot really see the cross section. I think you can see it. I don't know if you can see it. So this is the underside of the brain. This is the front part of the brain, and the back part of the brain. So this area that I removed, okay, this is the another lobe. So I removed it so we can see the middle of the brain. No? So in the middle, but I cannot remove it further. Oops, sorry. In the middle of the brain, okay, here in the midline, okay, there are areas here in the middle of the brain that actually regulates our emotional regulation, and then processes our memory. So in his meta-analysis, that's Neha Gothe et al. I'm not sure how to pronounce his family name. He found out that there are areas of the brain which became thicker, particularly the hippocampus, okay, the amygdala, okay, the gyrus cinguli, and the prefrontal cortex. Now, if we dissect it, the hippocampus, it's like a horse-shaped area inside the brain, just like this one, but it cannot be seen here. It's roughly after this area inside, no. So it is involved in production of memory and storing memory, and then memory. It's like siya ang most into a chronic one, or into a na stick na gid siya inside our brain, no. It will make our short-term memory into a long-term memory, so we can retrieve it several years after. So that's the work of the hippocampus, no. It is in a very delicate place. However, the hippocampus, it's very tricky. It's very sensitive to oxygen deprivation, that when you are subjected to hypoxia or lack of oxygen, for example, you're chronically hypertensive, and then you lose consciousness, you have hypothermia, then you lose consciousness, or other or you have an asthma attack, other other diseases which can lead to hypoxia, no, or cough, no, or COVID-19, God forbid, no. So if you lose some oxygen, that area of the brain is very sensitive, no, it will die. No, those are nothing but neurons, clump neurons or group of neurons. No, they will slowly die. No, and the more you lose those neurons, the more you become forgetful. Okay, that's the main manifestation if you lose it. It's more forgetful. Okay. Then so that's the hippocampus. So imagine it was found out that it's thicker in patients, I mean in subjects who went into yoga. As I said, the minimum number of sessions, I mean number of months was or weeks was 8 weeks. And it became thicker already. And then number two is the amygdala. Amygdala is just nothing but an almond-shaped group of neurons also, just in front of the hypothalamus. It is also involved in memory, in learning. The work of the amygdala. And also it has something to do with the behavioral reaction in stressful situations. This group of neurons is connected with your frontal part of the brain. Okay, this one, the frontal area. This one, by the way, will go to your nose. This particular nerve, no, will go to your nose and make you sense the smell. Okay, so it is connected also in the amygdala. That's why when you smell perfume, suddenly you remember all these things. Uy, high school pa ko ani nga perfume, no? Uy, akong uyab ani si kuan nga perfume, no? Something like that. So that's the amygdala. Our serious connection because it regulates the autonomic nervous system. As I know, yogis have been researching with parasympathetic and the sympathetic nervous system, right? So it regulates our reaction, our body reaction or physical reaction to a particular stressor, no? This one, the amygdala will process it all. So we will learn from these stressors and we will know how to act after, no, if we are faced with them eventually. Another thing is it is connected with the brainstem's locus coeruleus or a factory in our brain that makes stress hormones. So if you activate your amygdala, it might signal on your factory of stress hormone to make, which in yoga, by the way, is not a very good personality, right? So the amygdala is very dynamic in yogis in this particular meta-analysis. So that's quite a good news. The other one is the nucleus cinguli, or the area just above also the hippocampus. It's also involved in memory, in learning, no, and also in behavior, no. So this one has also connections with the frontal portion of our brain or our thinking brain. So it's also very important, no, in managing also stress and how we act or how we behave when faced with stress or psychological the other one is the prefrontal cortex, of course, as we know, is our thinking brain, no. So if this is the whole frontal lobe, sorry, okay, this one, it's like that. So this is the whole frontal lobe, okay. Then this one is the prefrontal cortex. That's where we think. That's where we process. That's where our executive function is being subserved. Meaning to say, our processing speed, no, our attention, no, our calculation, no, our executive function. Meaning when we are given a problem, how we attack the problem, how we plan to solve the problem, and how we execute the problem, it's all there in the prefrontal cortex, and it is thicker in yogis in this particular meta-analysis. So all in all, I could say yes, but no, however, as I said, it's just a meta-analysis, meaning they analyze a group of small studies. Okay, so we need bigger studies with bigger population or bigger group of people involved. The population we are talking about is I think 70 minimum. So it's like 70 people up to 140 people per study. So we need bigger studies, and then we need a longer treatment period of yoga. This one they evaluated after 6 months, and the brain already, parts of the brain already enlarged. So how much more if we extend it? What will be the long-term effects of yoga? No, if it
Yeah.
is extended studies for a long time, no. And also, another challenge is why which particular part of yoga, because these things that I'm telling you now also exists in aerobic exercises. And then
Mm.
they're very, yes, they're very different, 'di ba? So they're very different. However, in aerobic exercises, they did not seem to improve mental regulation. Only the yogis did that based on the measures, standardized measures for anxiety or behavioral practices. No, only the
Mm-mm.
yogis had that positive effect, not for the aerobic. So which particular part of yoga? The meditation, the breathing, or the postures or the movements? So we do not know. So that's a particular interesting topic to go into,
Yeah.
to research, or if you read which part of the yoga. And then another thing, that there's also a bias, because in a recent US survey, yogis tended to be more active, more plant-based, more into plant-based diet, more into active lifestyle, and then you compare it to non-yogi. So we might as well get, in order to be fair and to get the true picture of the effect of the yoga in the brain, we need to have a population that is more or less the same with the lifestyle of the yogis, no. So for example, population A is a yogi. Population B, you also have to get people who are also active, so it would be complementary with other exercises as well, not just yoga versus non-yoga, because
Yeah.
definitely exercise has already been proven to have positive effects. Okay, but in order for it to be pure, then we have to compare it with people who are also like yogis that are into active lifestyle as well. Then there is also no clear definition of what a yoga or a yogi is. No, there is no universal certification, because it's more on uh, your own pace, right? Manage your own
Yes.
pace, something like that. Yeah, so that is why the answer to that question is there are researches about it, a lot of it already. However, because of the limitations, we cannot really have a very good conclusion out of it. However, it's a very promising area of study. No, I haven't even delved into reading so much about the studies in yoga, in controlling diabetes, in cancer
Mm.
patients, which improves their sleep, their mood, and their quality of life. No, some studies were into improving asthma. No, and then some also in chronic low back pain, musculoskeletal disorders. No, and what comes to my mind is there are studies of yoga in controlling epilepsy in children and in adults. Now, it has something to do with the area of yoga that involves relaxation and breathing techniques. So in my practice, I would advocate it also in selected patients,
Mm.
knowing that there are already improvements in the anatomy and the functionality of the brain in a particular meta-analysis.
Thank you very much, Doc. No, I am so amazed with all the information that you have given us. I don't remember most of them, like the different parts of the brain, but I'm very happy with how you mentioned the effects of yoga. And coming from a medical practitioner yourself, I think we can learn a lot on how our executive functions, our brain functions, and our the different parts of our brain are exercised as well through yoga. And you know what, Doc? I had an action research in our school. I'm a school principal, and I actually give yoga to my teachers. And in that action research that I had, it basically affirmed a lot of the things that you mentioned about how to manage their emotions, how they can sleep better? How can they remember things more accurately than before the time that they did yoga? So thank you, good kayo, Doc. I
Mm.
feel very happy and affirmed listening to how a medical practitioner sees yoga and its practice. So
I hope
I
I
would
can get a, I hope I can get a copy of your paper.
yes, sure, sure.
Yes.
Although, Doc,
Kay lahi man tong
katong
yes.
akong research man good was more of a self-reported. Kini very amazing because I think this is more scientific because they use MRI and other scans that they observe from patients for a good number of a good number of duration lugar.
Mm, sorry.
Hi, sir. Welcome to our show.
But there is also a do you know that the scientific world is now into real time, I mean real practice research, meaning to say they're not just into the lab or the randomized controlled trials and all, they are also into the actual practice. So that is the novel thing in research nowadays. No, we also wanted to do those particular kind of research. No, how is it in the actual practice? No, because these are all like theories and everything. No, but how is it in your actual practice? So your research is actually also very important.
Yeah. That's why pala, Doc, no? There are a lot of schools who have been doing yoga and integrating it in their learning curriculum because you mentioned that it's good in terms of developing the brain to learn more, no?
Yeah. Yes. In those areas mentioned, no? Learning as well as adjusting to any stressful situations, no? It's like your behavior is now being influenced from what your past experiences were. So those particular areas of the brain responsible for that is enhanced with yoga based on the functional and the anatomical findings of that meta-analysis.
I'm happy you mentioned that, Doc, because in our school and in several schools in Cagayan de Oro, they've been trying to integrate yoga already in terms of instead of punishment, they try to have
Mm.
yoga sessions and to develop more mindful activity amongst children. And last week, Doc, our guest is teacher Honey, who is a yoga instructor, and she's really specializing in giving yoga for kids as early as
Mm.
young as they are. You know, she's
Mm.
parang a director or some sort in a tutorial center, and she's really integrating yoga in all of her activities.
That's very good to hear, no? Especially that the motivational outcomes to behavior in yoga is seen already in some studies, and then they can prevent actually depression, no, or distress, no, especially in that area of the brain called the prefrontal cortex, the thinking brain, no. So that's very good news.
Yeah, para as early as their young age, Doc, they'd be able to regulate themselves already.
Yes, that's correct. Mm.
Doc, have you had patients in your area of specialization where you recommended na, oh, I think kinanglan ka mag-yoga or I recommend yoga, try yoga to some of your patients na imong ginahandle?
Yes, a lot. I referred to Atemage. Most of them had back problems, but a lot of them had anxiety disorders. And then I haven't referred yet patients with epilepsy because it's more complicated. I have to make sure their epilepsy will not be triggered by hyperventilation. So the ones with anxiety disorders, they will come to your clinic with lots of complaints, to the point that they cannot focus anymore on one particular problem to tell you. They will tell you a lot of problems. So you can actually catch immediately these kinds of patients who are suffering from generalized anxiety disorders or even depression, hiding behind all those complaints of the body. So before I give them any pill, and it's of course it's very easy to do that, I recommend first the integrative part of it, no, as long as there's no medical or psychological emergency. So I usually have counseling, talking to them or
Mm.
refer them to psychiatry, or if not, it's not needed. In several occasions, I know Ate Mitch already received one of few, three or five of my referrals to her. The problem is when I follow up, kung naunsa na, ang uban, di gid mo to nga. Because maunhan sa anxiety. And of
Yeah.
course, they have this notion of lisod gyud ang yoga and all, no? Another thing that I am excited about is to refer older patients in yoga, because as I was browsing through these studies, no, I thought it was some studies, of course, had an age of participants of about 29 years old, 38 years old, or young yappies, no, young professionals. However, in a large trial, there were actually people more than 65 years old. No, these were the people they were really interested in, because it's this particular age group where your brain is already very compromised in terms of size, no, or
Mhm.
atrophy, ni shrink na. So there was one particular study nga ang lang age group is 65, no. So uh, these patients, we will have a hard time in letting them exercise, because exercise for them means jogging, aerobics, di man ko kabalo mo sayaw dok, kapoy man
Mm.
lakaw, wala man may park, gamay among balay, ana ba. No, so it's a yoga can actually be an interesting option or alternative to for them to have their prescribed, no, physical activity for the week, no, or especially if they have physical limitations or disability, for more rigorous exercises. So if they can do that, no, they can do actually yoga. Mm. Of course, as
Uh,
long as they're medically cleared.
yeah. Sige, Doc, there's a shout out here from one of your fans. I just
Ay.
usually hear her crack jokes and playing keyboards while singing out her lungs. This is my first time hearing her talking as a brain doctor. Proud cousin here from Taguig. This is
Mga binay.
from Sam's only girl, Lumad, Mindanao. So yeah.
She's a I forgot her rank. She's a Philippine Army. Sorry
Ah,
Kidot. Yeah, she's my cousin. Mga binayran siguro na nako, sir.
sige. We have here a question from a yoga teacher. Teach.
Hmm.
Doc, how about kung may epilepsy seizure disorder since 3 years old till now?
Yes. So that's what I told you before. I haven't tried yet referring patients with epilepsy to yoga classes. However, there is a there's a particular study of children with epilepsy in 2018 by an epileptologist himself. But the N, or the number of people involved, were only 20, meaning to say the people with epilepsy whom they enrolled yoga with is only 10. They divided into 10. And then the other one with epilepsy, but they did not do yoga, is also 10. No? So they gave treatments of yoga for I think 1 hour per day, twice a week, or 10 sessions in 2 months, something like that. No? And then they had a booster yoga on the third month, on the fourth month. And on the sixth month, they evaluated their seizure frequency and electroencephalography. So they had a baseline assessment of their seizure frequency. And out of the 10 patients, none had seizure recurrence in that 6 months where they were enrolled with yoga. And then for their however, in the control group, those that did not do yoga but still with epilepsy, no, most of them maintained their seizure frequency. These are people with epilepsy, children with epilepsy, who are already on medications. Okay, so yoga is just a palliative or part of the integrative treatment. No? So the second one is the electroencephalography. It's like having wires over your head, and then they will measure the brain waves, no, if there's seizure or no seizure or any changes at all. So their findings were very interesting, because only 1 out of the 10 patients had abnormal EEG findings, to the point that it's like their baseline tracing, no? And then, however, in the control group, or those who did not do yoga, 7 out of 10 patients still had the baseline abnormal electroencephalography. So that's very interesting for me. However, we have to be very careful because in patients with epilepsy, there is such a thing called we can ignite or we can stimulate more seizures if they hyperventilate, if we let them hyperventilate. Okay,
Mm,
hyperventilate is you take in a lot of you breathe in but you breathe out very fast. That's not like yoga, but of course these are kids, so we have to be careful in how to let them exhale also slowly rather than hyperventilate. Okay,
yeah.
because it's a seizure inducing procedure actually. When we record the EEG, we let them hyperventilate to see the abnormality of seizures in the brain. So it's not a very good scene if you have a hyperventilating kid in yoga when you're trying to teach the right breathing and they're just hyperventilating because of course maybe there's a communication problem or they did not get it in the first in the first few sessions pa, the style of breathing or the technique. So I am still going to study more about it and maybe partner with again with your studio in if a child is involved and if it's a patient of mine with epilepsy.
Yeah. Thank you very much, Doc. Doc, you mentioned that you've been sharing yoga to your patients who have anxiety disorders. And I think that very timely during these times, a lot of people are getting anxious because of the lack of vaccine, the possibility of catching the virus and going out there and it's GCQ and modified GCQ and whatnot. What can you advise these people who are anxious? And I think that when this anxiety builds up and it becomes problematic to people, no, what can you advise to these people?
I think it will be fair if I advise them to do uh, exercises or practices that can somehow reduce the anxiety. Now, of course, to start with, since this is a yoga talk, of course, I would recommend yoga as long as it's not medically contraindicated. No, number one, to relieve anxiety, as it is already proven to boost the brain mass or the thickness of the brain involved in handling stress and anxiety. No? In particular, the amygdala and the gyrocinguli. And then number two, it's also actually to boost your immune system. No, there is a systematic review also published in the Journal of Behavioral Medicine just in 2018, involving 15 randomized controlled trials, saying that yoga can have an anti-inflammatory effect, chronic, no, anti-chronic inflammatory effect. Meaning to say, they measured the chemicals that will increase when you're stressed, no, chronically or for a long time, no, such those chemicals are called cytokines, no, interleukin 1 beta and tumor necrosis factor alpha in particular. They decrease or they lower down. No, they are markers of chronic inflammation. Meaning to say, if you have chronic inflammation, inflammatory diseases, no, it can lower your immune system. So these the names that I mentioned will increase. So yoga in those 15 trials decreased those pro-inflammatory hormones and even increased one anti-inflammatory hormone. So that's a very promising area of research, no, for bigger trials. But those 15 uh, studies that were already studied were already randomized controlled trial. However, the population were only small, like it's a median of 70 uh, persons per study.
Mhm. Sige, Doc. We have here another from one of your fans, Samboy Loco.
Okay.
Kudos, Ate Sha, but I have few things here. I have been trying to get info about yoga and mindfulness activities and their benefits. Question: what's the difference between yoga and mindfulness, if there's any? Another: I'm really interested in it, but I want to know, where do I start? Do I have to be in a studio for a satisfactory result?
Okay. So yoga, you can learn definition of yoga from our teachers. Okay, that is a practice, that is a discipline. For me, yoga is a discipline. No, however, there are different types. But if you're into the combination of the mindfulness of your posture, your breathing, and your sensation, no, then that's a good yoga already to direct you into more self awareness, no. So if you can, or yoga will allow you or to move or to perform these modifiable positions or postures, no, in your own pace, and making you focus, but in a controlled manner. Don't kid me. They have to make sure that you're doing it correctly, no. So in a controlled manner, but you have to focus on your breathing to get there, and you have to be aware of all your body location, your posture, where your foot is at the moment, where the pain is. So you have to listen to it carefully. So all in all, no, it will direct you into more self-awareness, not just the breathing, but all the sensations. So this is a very good example of multi-system stimulation. You stimulate your body, you stimulate your breathing, you stimulate your senses, no, what you can feel, or your proprioception, what you touch, what you feel, no, even the heat that you are emitting in core exercises, you can feel that in yoga, no. So that's being mindful of everything, which will lead eventually to self-awareness if you're just religious at it. Okay, so it's effective if it's in a studio or if it's at home, if it's regularly done, because the clue there is you work on your own pace, but you have to commit to improve on it. You also have to have a good teacher, or at least man lang. In my case, I have my sister to tell me that I am doing it absolutely wrong, even if I've been doing it for a year. There are really some positions that the nitty gritty parts I really can't get it without a teacher in front of me. No, so I
Yeah.
don't need to go to a studio because of my schedule, and I have my built-in in-house sister teacher, which is an
That
advantage.
Yeah, that's very advantageous of you, Doc. No, you're very lucky to have to have a teacher and a sister as well. In my case, I just want to share. No, I started watching videos in YouTube. No, you can download a lot of videos in YouTube. But when I started being a regular practitioner in a yoga studio, I think that the advantage of that is the teacher, your yoga teacher, can actually adjust your postures so that you'd be able to maximize the benefits you get out of doing your yoga. And your teachers are here to help you to be more mindful and to more than the physical activity. It's really that is something happening inside of you that you should be aware of. And I think that is where the mindfulness comes in. No, so I think that thank you very much for that question, Samboy Lokop. That's a very interesting question. So let's proceed, Doc. Maybe you have some tips with our viewers right now. How do we become healthy, and how do we maintain balanced, healthy lifestyle considering our situation right now? Especially that, di ba, Doc, because we've been staying at home, quarantined for a long time now. No, how do we maintain a healthy balance and healthy lifestyle in general at this particular point of our situation?
Okay. So regular schedule would really help. If you have a schedule and you keep up to it, it will really help. Otherwise, we will come out 5 kilos heavier after this pandemic, no? So number two is really temperance, no? Just you can eat anything, but of course, you limit it, or you don't eat too much. That's it. That's temperance in all things. There's temperance. There should be temperance in everything, no? So number three is the healthy or balanced diet. No, eat a little bit of carbs. No, a little bit of protein, a little bit of fats. No, it won't hurt. Depends on your uh, the type of diet that you want to go into or you want to study and learn. Okay, and then it's not a there's a different formula from one person to the other. No, it's not because your husband is into French cooking that you will also follow, you can also follow your own. You can also have keto, you can also have plant-based, or whatever works for you and is healthy also for you. Then the 30 minutes per exercise session, if it's low to moderate exercise, no, it's just around 3 times a week will do. Okay, if it's just a not so vigorous exercise, moderate exercises, no, such as aerobic stretching, no, yoga, can be done 3 times a week. Just 30 minutes will do. Okay, 3 times a week. However, if it's a more rigorous exercise like jogging, no, swimming, tennis, or sports, but something you can do at home is treadmill or aerobic exercises in YouTube. You can do it just
Mm.
once or twice a week will do. No, not too much because it's already not in the heavy type of exercises. So once a week if it's very vigorous, and then once or twice or thrice a week if it's mild to moderate.
Yeah.
Yeah. Then of in your spirituality and in your physicality and in your emotional, no, health, of course, we have to take care of it also, no.
Yeah.
So in the physicality, of course, you choose your own exercise, and with all these evidences coming out from yoga, then I highly recommend it. Yeah.
Thank you. Thank you very much, Doc. And I think your sister, I think this is your sister here, has a comment. So I
Hello.
think I will be the one asking for a professional fee at the Mitch.
Yeah, she does
Because
that
your
all the time.
so basin paid na ni siya.
Sige.
So, thank you very much, Doc, for a quick chat with you. I really learned a lot from the points that you have mentioned, and I'm very sure that our subscribers out there are very much interested now to at least consider trying yoga with all the scientific evidences that you have shared to our viewers. Thank you very much, Doc Nats, and I'm hoping to share my action research to you in the research that I did for my school, no, and
Yes,
hopefully
please.
it adds to some of the things that the researches that you have read so far. Salamat kaayo,
Okay.
Doc Nats.
Salamat kaayo, Teacher Sam.
Thank you very much also for Teacher Mitch for helping us and connecting Doc to Chakra Yoga Studio.
Bye-bye.
So thank you very much again for tuning in to a wonderful, wonderful conversation with our Doctor Yogini uh, here. No, thank you very much for an amazing, amazing conversation. I've learned a lot, and you see really that yoga has been proven and has been tested and has been researched well by a lot of researchers abroad, and I was very affirmed, no, to learn how yoga can really make a difference in terms of our lifestyle. And in the end, I think it will still now be dependent on the kind of exercise we do. And I think the last few words of Doc would really be important. No? It's a matter of temperance. It's a matter of really making sure that everything is made into moderation. So thank you very much, Doc Sha. No, and I think that would be all for this afternoon in your afternoon chakra chat habit. I'm very happy that you are here with us. And next week, we are very happy to have a guest who will talk about financial wellness. I'm sure that is a very interesting topic, especially that in the past few days, financial capacities of our friends, of our loved ones have been affected badly because of this pandemic. And so see you next weekend. We are very, very, very excited to see you once again for another learning opportunity here in hashtag Chakra Chat. I am Teacher Sam, and hopefully you can continue to support Chakra Yoga Studio. As we say in yoga, namaste. Thank you very much, everyone.